Right. Mm. No, remember ka Sunday a ba dire deco, go tla le tente fela le di
You're on mute now.
Welcome to all our guests. Thank you for joining us today. It's been an interesting start to 2021. I'd also like to thank the presenters that will be sharing their skills, expertise, knowledge, and the like with us in the next while. I thought for a moment, though, just to reflect on 2020, it's almost as if it was a non-event. And I'm sure that individuals will know that 2020 took place, but the time period that we can relate to, as indicated in the COVID-19, was when it was discovered or realized in 2019. But 2020 went past in a flash, and that has forever changed the way we hold meetings, the manner of communication, and of course the fact that working schedules have changed significantly. No doubt many of you will be visiting this colloquium from your home or from an office or maybe even an internet cafe. So as we reflect today, we would like to help those who are sharing with us the information today get a grip on 2020 and what impact it had. Last presentation, we dealt with security, how prior to the festive season, what people traveling should be cautious of. The criminals are still very much active, and we've had feedback that it was very much appreciated. We, of course, also know that we had a psychologist talk to us about the effects of what the lockdown had done to many people, both at home and in the workspace. And then, of course, we also had some input on education and how to manage our finances. And we led to believe that April of this year should be a bit of a challenge because many people have, as it were, locked up their finances, they've borrowed money, and there's a day of reckoning. We do trust, though, that it could be different. And the purpose of today is to share some insightful, encouraging thoughts. So on our discussion this evening, or this morning, sorry, we're going to have Leighton Beard, and we're just going to hold that frame there for a moment. Leighton is going to have a look at what lessons we learned over the festive season. We know traditionally there's a massive amount of fatalities, What did lockdown do? As it was in the Easter period, did that change? So we look forward to Leighton sharing with us that information. He's from the AA, and we've known each other a long time, and I really respect the manner in which he can communicate this insightful information. New to us is a pharmacologist, Rudy. I'm sure that you'll agree. You know more people who are on medication, sleeping tablets, and the like. What has happened? And then, of course, we also look to the education specialist, Yumna. What are the challenges that 2021 will bring to parents and students alike? And then at the end of the discussion, I really thought this would give some insight into where we are. There's a discussion on what's happening in the funeral industry. As we sit at the moment, 25,000 deaths and climbing as a result of COVID. That's beside the other deaths. How has the funeral industry dealt with this? What are the things that they have to do with regard to COVID protocols and the like? So we look forward to hearing that. And that, by the way, will be a little bit different. It's a discussion between Rachel, who will host in it, and Pat Zwani from one of the biggest funeral parlors in South Africa. We will finish off the session with questions and answers. There is prize giving, and I would like to just draw your attention. We've got some quotes from individuals who had benefited from the prizes we've given in the past, and I'm quite sure they'll be happy. Clearly, if you want to send questions through to the chat room, they'll be fed through to me, and we'll deal with them at the end. And then we will put toward the end the rollout of events on the next virtual colloquium and the dates that we anticipate having them. So what I would like to now do is hand over to Leighton. He is the PR manager at AA, and I'm quite sure you will benefit from his insight. Leighton, we look forward to hearing your discussion. Thank you.
Yes, thank you very much, Eugene. I just want to start off by saying thank you very much to you and the team from Master Drive for giving me the opportunity to speak at this event, at this colloquium. Can you all see my screens? Is that okay for you, Eugene? Can you guys all see that?
Yes, I can see it.
Okay, so I mean the topic that I'm dealing with is what lessons have we learned from lockdown that we can take forward, and I'm specifically looking at the lessons that we've learned in terms of road safety in South Africa. But in order for me to do that, it's very important that we understand the context of road safety in South Africa, because if we only look at 1 year, 2020, it will give us a skewed picture of what the road safety picture in South Africa looks like. And the reason for that is because obviously a lot fewer people were on our roads during that time. But even so, there are some things that we can learn from that. But Eugene, some people may have seen this before. It is really critical for us to drive home the context of road safety in South Africa. And in order for us to do that, we need to look at certain factors. Now, the one thing obviously is we look at Africa, and Africa being this massive continent, and the number of people who live in this continent and the people who use the roads and the square kilometer areas that we have. And we see that South Africa is obviously one of the biggest countries in terms of square kilometer volumes and in terms of people who live in this country. So it means for us that if we have this very vast road network, that road safety must be a priority in our country. But sadly, as we have seen, and as I will show in my presentation, this is not always the case. Africa is the least motorized continent, yet it comprises 62% of the bottom 30% of all countries in terms of road safety. And if you have a look at this graph, South Africa has around 26 deaths per 100,000 of the population. Is everybody hearing me okay, Eugene? Or is this coming through okay?
Yeah, I can hear you, so I trust everybody else can, Leighton.
Perfect. So if you look to the left of this graph, you will see countries like Norway, the UK, Germany, Australia, Canada. They all are very low in terms of road deaths. We're looking there at around, in terms of Norway, just under 3 deaths per 100,000 in terms of road deaths. But if you look at a country like Liberia, you're looking at 36. South Africa is at 26. And it's a factor for us which is extremely concerning. We would obviously like to bring that number down, and there are a number of factors which we have to introduce to bring this number down. South African road fatalities 2010 to 2019 And there's a very specific reason I haven't included 2020, and that's because the 2020 numbers haven't been released yet. They will only be released sometime in April. I'll get to that a bit later. But when you look at this graph, it's very clear that over the last 10 years, we've lost around 135, 140,000 people in road accidents on South African roads. And that's a major cause of worry for the AA and for people like Eugene and all other road safety protagonists in our country. This figure is simply too high, and something needs to be done about that. And I think what's really critical about this slide as well is if you look at that yellow stretch, and that's pedestrians, you see that pedestrians comprise a very big chunk of those people who die on our roads annually. And that is very, very concerning. It's not only road accidents, but the impact of motorization on pedestrians is equally worrying. What is the picture now? So the full annual statistics for 2020 are not yet available. They'll only be available by April 2021. So we base all of our data off the official figures from the Road Traffic Management Corporation. There may be some people who query those figures and say they're too low or they're too high. I know that there are many people in paramedic fields and doctors at hospitals who say that the figures that are given by the Road Traffic Management Corporation are out of kilter with the actual reality on the ground. And that may be the case. There are issues in terms of the reporting of road accidents, road crashes, and road fatalities. It's a very cumbersome process where a police station, a police officer in a police station actually has to fill in a form. He has to then fax that form through to a central database, and that data is captured. And obviously, the more wheels in that process, the more chance that data is going to get lost. Be that as it may, we can only work off the official figures because there are very few people, well, besides the RTMC, who collect this data. So if you're looking at official data, those are the official numbers. You can believe them or not believe them. They are the official numbers, and that's the numbers that we work off. When we look at, and I've included the December stats here, but I'll take you back. If we look at the festive season stats in April last year, and Eugene alluded to this in his intro, the Easter road fatality statistics of 2020, they were down by 70%. Now, everybody's going to jump up and go, well, there you go. Road safety in South Africa is sorted. Well, no. The issue there is that traffic volumes in the country were down by 70%. And we saw the same situation repeating itself in December, when we looked at the 1st of December 2020 to the 11th of January 2021. 1,616 people died on SA roads. That was a 10% reduction over the same period the previous year, in other words, 2019, 2020. But traffic volumes were also down 10% from 1,556 to 1,410. So the lesson learned, well, not much has changed because of lockdown. Yes, we've got fewer cars on the roads. Yes, that is leading to a reduction in the number of fatalities. But is that really something that we can point a stick at and say, well, there is the solution? In a way, we can say that reduced traffic volumes will obviously lead to reduced traffic crashes, and reduced traffic crashes will lead to reduced deaths. But we know that that situation is not going to continue in perpetuity. Our volumes will increase again. We're already beginning to see that on some of the major routes. I'm in Cape Town at the moment, and I can already tell you that although the traffic volumes are lower here than what I expected them to be, they are higher than what they were 3 or 4 months ago, and certainly higher than they were during lockdown. So traffic volumes are down, and that is leading to a reduction in the numbers. It still points to a great need for more intervention.
Documents, and then that is for
Sorry,
two parcels.
hello. I'm getting some feedback. I think somebody else is on the call. Oh, there we go. I think that we mustn't be confused to equate lower death rates as a result of lower traffic volumes as a success. We are still of the opinion as the AA that a huge amount of intervention is needed. And I get asked this question all the time, but what must we do? How do we sort the situation out? And one of the things that we continually go back to, and this is a lesson that we have learned, it may be something that we've learned through COVID. Yes, traffic volumes may reduce traffic crashes, but as I said, that's not going to continue in perpetuity. What intervention do we need? In 2016, the then Minister of Transport, Depur Peters, put together a committee called the Traffic Law Enforcement Review Committee. And the findings and recommendations of this committee have sadly gone very much under the radar and underreported. But for the AA, the recommendations that came from that committee are incredibly critical. And I'm not going to highlight all of them because there was something like 42 of them. And I know, Eugene, you're probably going to be looking at your watch at this point going, come on, buddy, speed it up. But let me get through some of the main points. And I think when we look at the lessons that we need to take from COVID-19 and apply going forward, these need to form part of that. The first is we need to professionalize the traffic law enforcement environment and have an independent professional body for traffic law enforcement. That goes without saying. We don't have that at the moment. We need a single traffic police service for South Africa, which should be created in a phased manner over a defined period. That is not happening. That didn't happen during the COVID lockdown. We had less cars, so there wasn't a need for that. An increase in funding and resourcing for traffic law enforcement. The review committee noted, it is apparent that the current numbers and resources are grossly inadequate and that the country needs at least double the amount of traffic officers it currently has. The issue with this statement is that when you have reduced traffic volumes and you have concomitant reduced traffic deaths, the argument is, well, we don't need more traffic officers. Well, no, we definitely need, at least according to this review committee, which was quite extensive, I might add, we need double the amount of traffic officers we currently have. We need the adoption of a graduated driver licensing system. And I know, Eugene, this is something that you are very much in favor of, with a 24-month probationary period for new drivers. We need the introduction of driving as a subject in schools for grade 11 and 12. We need the redesign and updating of the K53 driving test with practical on-road driver training. We need the enhancement of outreach and public education initiatives to improve driver behavior, the creation of national regulations for vehicle towing companies, compulsory annual roadworthy tests for vehicles older than 5 years, and significant increases to penalties for distracted driving infringements such as cell phone usage, which, by the way, is not covered in our view adequately through the auto legislation, which is planned for rollout in July. The reason I mention these 10 points is because these are the things in our minds that are going to lead to reduced numbers. So we speak about what lessons have we learned during COVID. We haven't learned that many lessons. And it's difficult to learn a lesson when there are fewer cars on the road, and that's leading to fewer deaths because it creates the impression that things are being done to advance road safety. And these things need to be implemented amongst others, not the reduction in the road in road traffic volumes. As I said earlier, we've had 135,000 deaths over a 10-year period in South Africa. And that is a huge amount, that's a huge number of people who have died on our roads. And to put that into context financially, we look at this cost of crashes report. And this is a cost of crashes report that was developed by the Road Traffic Management Corporation in 2015. Now you ask, but where is the updated version, Leighton? Why didn't we have the 2020 version? Well, this was the last version that was actually prepared by the Road Traffic Management Corporation. And I'm not going to go into any detail in this. I would just draw your attention to that figure in the top right-hand corner of 142 billion rand. Now, if we extrapolate that with inflation over a period of 5 years to bring us to 2020, we're closer to about 180 billion. That is what crashes in South Africa are costing our economy, 180 billion rand annually. Now think for yourself what you could do with 180 billion rand nationally. You wouldn't need to cut funding to essential services. You would be able to fund more essential services, and a COVID vaccine rollout would be much easier given that you're already saving this amount of money. When we look at, I'll go back to that slide. When we look at that 180 billion, it's a huge amount of money. And the point that we make with this is that road safety isn't only the domain or the purview of people involved in road safety. It has an impact on every single South African because it puts money back into our fiscus that ordinarily would be taken out to cover for road crashes. And that's where the concern lies. Now, these are not my figures. This is an official figure from the Road Traffic Management Corporation, which is an arm of the Department of Transport. This is an official figure. This is based on their own calculations. Government is aware of this, and this is something that we think needs more attention. And it brings me back to this slide over here. And that is where we need to be focusing our attention. When we ask what the lessons are that we've learned, we need to go back to 2016 and say, we've got lessons that we've been told we need to learn from the Traffic Law Enforcement Review Committee. That's where we need to focus our attention. Now, I'm not going to go into any detail into who needs to step up. I'm going to go through these quite quickly. And I think the point of this is just to give you an idea of where the priorities lie. People ask, does government need to do more? Transport, health, policing, and they'll be talking about allocations in budgets and the departments. The OEMs, the manufacturers of vehicles, do they have a duty of care to the customer? And is there a personal responsibility from the motoring public? And the answer to all of these is yes, everybody needs to step up. But when we look at government, road deaths as a transport priority is very low because they're looking at other issues. We've got issues with Sunroll. We've got issues with taxi violence. We've got issues with Transnet. We've got issues with SAA. These are massive billion-rand problems that the government is saddled with. And from a transport perspective, these are the things that enjoy priority. Road crashes and road deaths, sadly, are lower down on that scale. And we feel that they need to be higher up. I'll skip through this one. As a policing priority, we know that drug crime, burglary, and the stats were released earlier this year. Gender-based violence, which is a scourge on our society. These are priority issues for police in South Africa. Road deaths, very low on that scale again. So you can see a trend developing where road deaths and road crashes don't enjoy the priority that they need to, but it's an issue because when you compare or when you look at the numbers involved, that 180 billion rand cost to the economy, it should enjoy more of a priority than it currently is. As a health priority, we've got other issues. We've got heart diseases, we've got TB, we've got HIV, we have COVID-19, we've got coronavirus to deal with. Road deaths, again, very low on the totem pole there. So who needs to step up? We've obviously got the OEMs. They are introducing safety features in vehicles. I won't go into detail in this. I think everybody's aware that manufacturers are beginning to put technologies in vehicles that make those vehicles safer. And for us, that's a huge step forward. It's a massive leap in terms of road safety. And we want to encourage that to continue even more intensively than it is at the moment. Motoring public, 90% of road deaths in South Africa are caused by human error. So we look at the question of what lessons have we learned through COVID-19. One of the things we did notice was because there was a reduction in the number of vehicles on the road, people began to drive worse because they didn't feel the need to actually obey all the rules of the road because there weren't that many cars around for them to obey those rules with. So you'd find people maybe changing lanes without using their indicators or talking more on their cell phones or using mobile devices while they were driving. We know that during those periods, law enforcement was maybe focused on other areas, so people weren't always wearing their seatbelts. Speeding was becoming an issue, and these are all, this is all anecdotal evidence that we received from people who were driving during those times. And unfortunately, those bad habits will continue when the traffic volumes pick up. And that's why I'll go back to that slide earlier of what does the Traffic Law Enforcement Review Committee tell us and what are the things that need to be implemented from that to make road safety a priority in South Africa. South Africa alone has a higher death toll over the summer holiday than either Australia or the UK have for a full year. That is an incredible statement. I think it speaks a lot to their law enforcement environment. Obviously, in these countries, that would be a lot lower for 2020 because of the reduction in traffic volumes there as well. But again, there is a framework and an environment of road safety and law enforcement in effect in these countries, which we just don't see in South Africa. And again, I bring you back to 95% of all accidents and crashes are caused by human error. We look at this slide. This is a survey that the Automobile Association did, and I'll take you to the far right-hand column where we look at the green. 36% of people say that they are near perfect when they travel on highways. Now, anybody on this colloquium will tell me that simply isn't true. But if I had to ask you individually, you'd probably say, yeah, I'm a very good driver, but it's the other guy. And that's the problem that we've got. Everybody blames everybody else. It's never yourself. And that is where the issues lie. People will say they're above average or they're near perfect, but in fact, we know that that is not the case. And it requires vigilance all the time behind the wheel to ensure that we are safe. And that's also just not happening. And that vigilance needs to be backed up by proper law enforcement and stiff penalties for people who break those laws. I mentioned this, it's the other guy. We see there 40% of people just above think that they are above average when driving, but 40% think it's the other people. And I think that this gives you a very good idea where as individuals, we think we are better behind the wheel of a vehicle than somebody else, and it's not always the case. I'm not going to go through this in too much detail again. It's not a priority for government. The OEMs are making strides, but more needs to be done, and the motoring public just believes it's not their problem. So what now? And what have we learned from COVID? I'll return to this again. We haven't learned a lot from COVID. It's difficult to learn a lesson, when the traffic volumes are so low that it's inevitable that you're going to have a reduction in traffic crashes. We don't have the full statistics for 2020 just yet. I think that those numbers will come in extremely low, but they do need to be seen in the context of the fact that as low as they will be very much parallel to the reduction in road traffic volumes over those same periods. So is there really a lesson that we can learn from that? The answer in our view is no. We need to go back to proper law enforcement, as I mentioned earlier, and we need a safe systems approach. We need safer roads, we need safer vehicles, we need safe users, and we need effective post-crash intervention. And all of that needs to work within a proper road safety management environment, which includes effective and punitive road traffic law enforcement. We need education, education, education. Drivers need to step up. Again, improve traffic law enforcement, harsh punishment for offenders. People need to teach their children to drive by example, and that is an outflow of everything that came before it. And obviously, we need better roads. Just to end off, I'll bring you back to the numbers again. The 180 billion. If we reduce our traffic crashes by just 1%, we are going to be putting 1.8 billion rand back into the economy. And there you can see we could build schools, we could build hospitals, we could fund bursaries, we could fund better vaccine rollout, we could improve healthcare. There are so many things that we could do with that money, and that is why we believe that road safety needs to be a priority. We cannot simply look at a year like 2020 and say we've learned so much from that because our road deaths are down, when in fact it's a false narrative because the traffic volumes were down over the same period. And that, Eugene, is that.
Thanks, Leighton. As always, I look forward with a degree of trepidation to what information you share with us, because as has turned out to be the case, one hopes for the best, but it clearly looks like it's not there. I just also confirm some of the experiences that we found. People's driving deteriorated horribly, muscle memory was gone, they took chances. But the worst thing that I found is that many people thought that they were dealing with COVID, so they now could neglect road safety. On a more positive note, many of our corporates that we're engaging with are talking to us about how they can phase in aspects of training that will address the issues that have occurred during COVID. And if I can just close off there, yes, the minister tells us auto is coming irrespective. My question to anybody who's listening here, because we are probably more corporate, is what have you done to prepare yourself? In tests that we did recently, on average, when we took a driver out, within 1 hour, they would have incurred 3 demerit points. So it's something that's really serious, and we have to consider the implications. But thank you again, Leighton. We appreciate that. And if you're going to hang around, we have questions. By the way, just in case you think there's a few people, we're also on Facebook and we've made provision for YouTube. So there's a lot more in attendance that we can see. Let's now hand over to Rudy. He's a pharmacist. He's got his master's, correct me if I'm wrong, Rudy, in pharmacology. Is that it? And I think you're going to give us an interesting perspective on how we can cope and how people have been coping. Over to you, please, Rudy.
Thank you very much. And thank you for allowing me to share some of our experiences we've had last year as we've come along this journey. As one of our patients called that Spanish-sounding beer virus. I apologize for not having prepared a PowerPoint presentation, but instead we'll be just sharing some of our experiences the last year that we've had as we've come along this journey with COVID. As per the introduction, we started off in March with a 21-day lockdown that is still carrying on. And pharmacies' stores have stayed open, and we've been trying to help our patients the whole time. We started off with what we jokingly called the extended weekend syndrome, as people realized that they've got to stay home, and as per the traditional weekend, when there's bad weather outside, I'm going to stay in my pajamas, I'm going to stay in my slippers. I'm not going to go out. I'm going to sit on the couch. I'm going to watch TV the whole weekend. I'm going to eat junk food. I'm not going to meet anybody. And I'm going to forget to brush my teeth. I'm going to not brush my hair. And after 7-8 days of this, suddenly my gums start bleeding. So at the start of lockdown, we started treating a lot more, let's just call it funny type infections and problems that we were picking up with our customers and our patients. Amongst those, bleeding gums, gingivitis, a lot more cold sores, a lot more rashes around the face because of people having to wear their masks. And I'm sure everybody will agree with me. We're all going to go away from this with permanent grooves in our earlobes where our masks have been chafing us. And people started presenting with illnesses that we usually ignore. We also started seeing people, men that would tell you that the softest part of their bodies are their teeth, coming in and complaining that all the hand washing is hurting their hands and made their hands very sensitive. That had, strangely, a very positive effect for us in winter, June, July, August, where we didn't see that much colds, flus, because people were now actually washing their hands and dodging anybody with a sniffle or a cough. As the year progressed, we also then started picking up the more serious trend of patients becoming a lot more anxious, becoming a lot more stressed, depressed, patients suddenly having sleeping disorders, unable to sleep, sleeping fitfully, not being able to relax. As the year went on, and I'm now talking towards October, November, as it became obvious that the second wave was going to come through and 2020 wasn't going to end off with us saying goodbye to COVID, we started picking up a lot of our patient base suddenly now suffering from what we would like to call a mental fatigue. They're not physically fatigued, they're just mentally tired. And we have picked up, as the year's gone on, a worrying trend of patients using a lot more scheduled medications to treat anxiety, to treat stress, depression. Men traditionally don't really suffer or complain of being depressed, but we've picked up a lot of our male clients that are now having been put onto antidepressant medication. The economy, the stress of not being able to work, the pressures going along with everything is had an effect on our patient base. We have found that a lot of our customers have picked up a lot of sleeping disorders, And as the year has progressed, we have been selling a lot more over-the-counter sleeping aids. We've also had some very, very strenuous and serious conversations with our patients who suddenly are drinking 3-4 times the amount of tablets that they should be drinking and running out of their medication before they should be running out of their medication. Everything to do with the stress that they're under. When second wave started, we also suddenly picked up people suddenly wanting to understand the illness more, wanting now suddenly to use Google and find out what they can use themselves to boost their immune systems. And into December and January, as we started seeing more and more prescriptions coming into the pharmacies, where doctors were promulgating vitamin C high doses of vitamin D, selenium, and zinc to boost their patients' immune systems, we suddenly had an uptake where a lot of patients would come in and they would be asking for these type preparations. Along with stockpiling, a lot of over-the-counter colds and flu medications, nebulizing medications, and even asking us for portable oxygen cylinders in case somebody would get sick within their families. We continue seeing patients under stress. We continue seeing patients coming into the pharmacy asking for boosters, injections, stuff for the immune system, stuff that would help them that we normally wouldn't be doing for them. Patients have, as the year has progressed, made peace with the fact that COVID is here for a time. But in the pharmacy, we remain the first point of call for that dreaded question. So, do you think I have to go for the test? Or even worse, I've just come from my sister, my brother, my mother, my uncle, my aunt, and they've tested positive. What must I buy them? But don't worry, they're sitting in the car, so it's fine. These are daily occurrences that we deal with in pharmacies, and I think we'll continue dealing with them in pharmacy as we carry on. But we have found that our patients, as we've gone along, have started trying to find alternative ways of boosting their systems, trying to protect themselves. And people that have gone from eating burgers have now started trying to be on diets and have started to ask us questions of how can we look after ourselves better as we go along. As one of my patients told me, I used to go to work at 6:30 in the morning and get home at 7 o'clock at night. I have absolutely no idea how much my domestic worker did every day in the house. So it's been a change for everybody concerned. And in pharmacy, all we can do and what we will continue doing is trying to help our customers, our patients, educate them, continuing to help them, trying to sort out when there's issues. But as I've alluded, as the year went on, we moved from what we jokingly call the weekend syndrome into this mental fatigue that we are seeing nearly daily in half of our patients, which is causing, alarmingly, an increase in your Schedule 5 antidepressants, your anti-anxiety medications, your sleeping medications, and an abuse of those medications, where a person would be buying one packet a month, one tablet a night, now all of a sudden after 10 days wanting another packet, having used up their medication for the month. This unfortunately will continue until we can sort out what is going on and people can come to terms with everything that's going on. We continue getting questions about the vaccines, and it is quite humorous having to listen to people and the conspiracy theories around the vaccines, which range from we're all going to end up like zombies in like that movie The Walking Dead, to we're all going to be digitally and genetically transformed so that governments can make us pay our taxes more often, right through the gamut with everybody asking us all these strange questions that they're reading online about the vaccines. But from a pharmacy perspective, and we keep reinforcing this to all of our patients, is that as soon as you can get this vaccine, you should go for the vaccine. If we can get herd immunity and we can somehow just start lowering the incidences, the sooner we can do that, the sooner we'll be able to take our masks off, the sooner we'll be able to get back to a post-COVID normal world, which will never be quite the same again. But if we just all keep being disciplined, keep washing our hands, keep wearing our masks, and doing what we can for one another, we will get through this. Apart from that, there's not much more that I can really share. We've gone through December, January, and now most of February through the second wave. We've dispensed record amounts of antiviral medication, antibiotics for people that are bunkering themselves at homes in case they get sick. Hopefully those will help those people. We continue trying to find as much vitamin D and vitamin C preparations that we can for people to boost their systems. And we keep helping people coming to the pharmacy that want a vitamin B co-injection. Stay safe, and thank you so much that I could share with you guys. And please, if you walk into a pharmacy, please remember your mask. We get quite nervous when you walk in there and there's 15, 16 other people in the queue and you're telling me you're coming to get something for your mom who's just been tested positive. Thank you very much, and thank you for allowing me this opportunity to share some of our instances in the pharmacy. Thank you very much.
Rudy, thank you very much. I'm sure you'll agree this is not nearly as traumatic as you envisaged it to be. No. We're having a conversation, and I think the manner in which you conveyed that was informative, interesting, and it's something that we wouldn't normally talk to. So thank you for that. By the way, the presentation is recorded, so if you'd like to share this with others, and I'd also especially like to thank Rudy and his team, who've done a lot to ensure that our frontline people have coped with COVID. We are glad to tell you that we've had 0 incidents in the company where people have contacted COVID. Our last laboratory test, when we opened again, showed a 100% healthy state. So partly to you, Rudy, and your colleagues, we thank you very much, and we hope that you can stay along to join us. We're now going to move to another interesting discussion. We had Yumna on last year, early part of the year, to talk about education and the challenges. Personally, I feel sorry for the parents, but it surely is interesting. But given the fact that we had such a phenomenal pass rate, whichever way you look at it, I think it deserves our teachers, principals, and schools deserve a lot of credit. So please, let's hear what she has got to share with us. Yumna, over to you, please.
Thank you so much, Eugene. I'm just going to share my screen quickly. Sorry, Eugene, it's not allowing me to share my screen. Oh, there we go. So, hi everyone, and thank you to Master Drive for this opportunity. I would like you to please just ignore a lot of the noise in the background. I am currently in my office at school, so there is a lot going on at this moment. I wanted to start off by introducing myself. So my name is Yumna. I am the Deputy Principal at Abbott's College in Johannesburg South. I did speak previously to at a webinar hosted by Master Drive regarding the challenges that we were facing during COVID. And it was very much at a point in the school year where we were reaching the end of the school year, and there was a lot of stress and anxiety as to what is going to be happening with the examinations and how the year was going to end. When I'm talking today, I'm talking from a slightly different perspective as well. So as the deputy principal of a school, I just want to give you some background in terms of where I am speaking from. So the school that I'm at is a private institution. It is not a government school. It is a very small school where there is a lot of interaction. We only have 300 students. So there is a lot of interaction between students and teachers. So we are very much aware of what is happening within our students' lives and the impact that COVID has had on them both in school and at home. Also, as from the perspective of a mum, because I have a daughter that is in the schooling system. So looking at the impacts that has had on her and her schooling, as well as a daughter. So both my parents are in the medical field and healthcare workers. So COVID is something that's very much real within my home, within my family. It's something that the fear is there all the time, knowing that my parents are just as much as a risk, and we see the challenges around that. So from a schooling perspective, we definitely do see the fear and the anxiety around the pandemic, and it's been very real this year. I think for a very large percentage of last year, we didn't see a lot of infections within our school. We didn't see a lot of the impacts. But coming back in January after the holidays, we really have seen the impacts that it's taken on our students. And you're seeing that fear and then anxiety. And I think a lot of that has come from the fact that students have lost close family members. Some of them have lost parents, some have lost grandparents, some have lost a number of people from their extended families. And this has upped the fear and the anxiety that they are under during this time. We're also now starting to see where students are feeling the financial strain at home. So as a private institution, we're seeing students that are having to leave the school and look for other alternative schooling because of the fact that families cannot afford the fees anymore. We're also seeing the impacts in terms of spending money, clothing. Many of the students can't understand, they can't fathom the fact that mom or dad or a breadwinner or a guardian has lost an income because of COVID, and they are now feeling the strain of that. Coming from home, it's not just the financial strain, but also the tension within the house that is created as a result of this. And now they are feeling it as real as, I don't know what's going to happen. Am I going to be wearing a mask for the rest of my life? There's a lot of talk amongst people with regards to the vaccines. Do we do the vaccines? Don't we? And that is adding to the fear and uncertainty for these students. Over the last few months, and as I said, particularly over the last few months, January, February, when students have returned to school, what we've experienced, and looking at our results from last year, is that we went online saying that things will continue, it's going to happen. And yes, the learning and the teaching happened. Students managed to complete their syllabus, they didn't miss out on work, whereas in many government institutions, this was the challenge that students faced. They didn't cover all the work that they did from the previous year. But from an online perspective, it's not something that all students can do. If parents know that their students are capable, or their kids are capable of doing online lessons, you send them to a fully online school. But going online doesn't necessarily solve the problem for all students. And we see a decrease in the marks of those students. Even now, it adds a lot of laziness into the students, because when the option is there for you to be online, many students choose to say, I'll work online rather than coming to school. Or parents, due to fear and anxiety, choose to keep their children at home. But it doesn't necessarily work for every student. Where schools are staggering their days and staggering their times, that also affects students, because the laziness sets in. It's one day on, one day off. We all know Blue Mondays, what it's like. Now imagine these students that have a weekend halfway through the week because they're not going to school. It creates that laziness, it creates the break in the routines. And for many parents, they are unaware of this. They believe that my child is either working online or my child has work that they are completing at home during the staggered days, but they're not aware of the difficulties that these students are going through. Have a phone next to you while you're doing your lessons, texting your friends, watching TV while doing homework. And last year, for a large part of the year, parents were at home and they were able to monitor what students were doing on the days that they weren't at school or the days that they were online. But now with businesses opening and everything back to some sense of normalcy, parents are not always at home to monitor these students. And these are some of the challenges that we have been seeing within the school. And this is affecting students' emotional well-being. It's also affecting their marks. Students need that structure. At the end of the day, whether they are grade 1, grade 6, grade 12, they still need routine. They need structure. They need that formal environment. Teenagers are social beings. That's what they live for. They live for their friends. They live for being out there and engaging. And we see this when we return to school in the new year. We also see it after the breaks. As much as you can reinforce social distancing and from a school perspective, these children see each other after a long time and all they want to do is hug each other and be around each other. But we need to remember that as parents, that we need to find ways of keeping them engaged with their friends and having some form of interaction in a safe manner so that they don't feel isolated and they don't forget the rules when they are eventually in these environments where they are with their friends. Obviously, this settles as the year progresses, but particularly when the year starts, or when the term starts, we see this amongst the students. Many parents are also not aware of the stress and anxiety that their children are going through. If we speak to kids, sometimes we see students that have a meltdown or that are just having a bad day. And when we discuss it with them, they're talking about, I have a family member that's not well and I don't know whether they're going to make it, or I've lost so many members of my family, or I'm worried about my mom, or I'm worried about my dad because they are at high risk and I don't know what's going to happen. And when we ask them, have you had these conversations with your parents? Are they aware of how you feel? Many of our children are saying no. They don't have these conversations. They feel like in the environment that we are in, they need to grow up, they need to be responsible, and they don't want to have these conversations. So we need to be aware of what they're going through and aware of the stress and anxiety that is now filtering down to them as time is going on. We've obviously started the new year already, but some tips and advice for parents just going into the year and as we go through the uncertainty of what the future holds in terms of lockdowns is remain positive. It's okay to feel anxious and to let your children know that you are anxious, but remind them that it's not the end. There is hope. We are here. We're going to support them. Okay. We also need to remember that we have to allow for that social media. For many students, their gaming, their social media, obviously within a monitored and safe environment, it needs to be there for them. It's their escape from life. It's their go-to when they need to just drown everything out. So it needs to be monitored. It needs to be under supervised conditions, especially depending on the age of your children. But allow them this escape, allow that reward to be there. Also keep in touch with them. We generally say that with our younger kids, we have those conversations on a daily basis. What did you do at school today? How was your day? How did things go? With our teenagers, we tend to forget that. And we need to show them that despite everything that's going on, despite the hecticness of work, despite the pressures that are coming with COVID, the financial strain, show them we are interested in what is happening in their day-to-day basis, extramurals, assessments, etc. Have those conversations with them. Also very important for us to go back to the old system of keeping track of their routines and their activities. What's due at school, when do you need to be where. Remember that we still have to be there for them to support them and to provide that emotional support. Also very, very, very important, and this is one that I have seen when I meet my students over the weekends and when we chat to them over the week, is know where your kids are over the weekend. You would ask a lot of students, what did you do this weekend? Oh, I was just at my friend's place. How many of you were over there? No, my friend's parents were working this weekend, so we just got together and we had a study session. And we all know what that means. Those study sessions, those group get-togethers, we know they miss their friends. We know they need that interaction. But when they are having these group get-togethers, they're not practicing social distancing. They're not wearing their masks. And that increases their risk as well as your risk, because they are bringing this exposure home. So always know where they are and what they are up to. Lately, we have found that a lot of our COVID cases amongst our students, and yes, we are now seeing a lot of students that are getting sick. Thankfully, we haven't had anyone that has been seriously sick and having to be hospitalized, but we are seeing our students that are now being infected with COVID, and most of it is coming from home. So mom or dad has got COVID from work, and that has now filtered down to the students and passed on to them, and they're getting sick. And this makes it very difficult. So one of the biggest pieces of advice from a teacher that I can give you is monitor your children. If you feel that you have been or could have been exposed at work, if you feel that you are showing symptoms of COVID, keep your kids at home. 1 or 2 days is not going to make a difference, because that is the biggest thing that we have seen. Parents are getting infected at work or in their social environments, are then passing it out down to their students. And obviously the kids are not as diligent, especially in the younger grades, with making sure, particularly during break times when students are eating, in making sure that their masks are not off for long periods of time. Okay. In terms of the changes that will remain with COVID-19, technology is a big thing. I know particularly in our school environment, we've realized that these are skills that we take for granted. You know, we give a child a cell phone and we know that anything you need to know, you ask your child and they're going to be able to answer you. They will tell you how to do it, when to do it, why to do it. But when we put a computer in front of these kids, some of them have the digital literacy to do things, and others, it's a very different shift, moving from a computer, from a cell phone to a computer. So it's changed the way we're doing things. Teachers have upskilled themselves, students have upskilled themselves, but there are still challenges that are going on. And the shift to technology really has highlighted the inequalities within our society. Many a times we take for granted and we assume that students have access to a device, to the internet, etc. But with the financial strain that has come from COVID, we're seeing the impact of this more and more. So it is preparing them for the world which they will enter into once they go to the universities and once they go into the working environment. But there are still many struggles and challenges that we have with this. We, from a school perspective, have also seen that there is a much bigger appreciation for the teaching fraternity. Parents are now fully aware of the struggles and the challenges that teachers go to, and acknowledge that the work that we do is very much different from any other career. And students, teachers have also been reminded that we miss each other, we need each other, we look forward to that interaction, and we've learned over this last year that teaching happens in the classroom. We need to be there with one another, we need to see each other, we need to engage with one another in order to get through this changing environment that we are facing. And I think from my side, just to finish off, the biggest lessons that we have learned is, one, don't take anything for granted. You know, we plan and we plan and we plan, and things change. So let's appreciate what we have. Let's appreciate the fact that we have access to education, that our children are able to get an education. There are many children across the world that can't afford to get access to any education because of the impacts of COVID. Also important to remember that as difficult as COVID has been, some students have managed, others haven't. Okay, some don't have that grit and that versatility to get through the times, and we need to be there. We need positive reinforcement, we need encouragement, we need to support them all the time, and remember that they are feeling the same way that we are. And just the last thing is, it can be done. We can make it through. We can push, we can succeed, and our children have it in them to do this. If we look at the class of 2020, we have got amazing results from some students. In schools where children were not attending school every day, where they didn't necessarily have access to resources, we have seen the results coming through, which means it's strength and it's motivation for the class of 2021 and for all students out there to say, it can be done, there is hope out there. So thank you for that, and thank you for giving me the opportunity to share my experience with you.
Yumna, thank you from everybody in attendance. I see some of the comments in the chat group. It's so refreshing to know that other people are experiencing similar challenges. And above all, and I'm not sure how you feel about this, our children could be scarred, but I do trust that what we do now, we'll see whether or not this is a positive outcome for them, and that they can override and overcome any objections and hostilities that they encounter. So thank you for sharing those positive things with us. We really appreciate it, and I'm sure the whole audience does so as well. Now, let's move through to what I'm looking forward to with some anticipation. We have got Rachel from Funeral Cars, and Pat Swani. As I said, he runs one of the biggest funeral parlors in the country, and they're going to share with us some of the experiences, what happened during COVID. So please stay with us as we hand over to the team there.
There we go. Hello, everybody. How's it, Eugene? Thank you for the invitation this morning to have a chat with you. Should we put our
Hi,
masks?
Rach. Hi, Pat.
Hi, how's it? Be appropriate. Hi, guys. How's it? I'm Rachel from Funeral Car. Thank you once more for the opportunity this morning. By means of introduction, I started Funeral Car a few years back essentially as a motoring website for the funeral industry in South Africa. I do consult quite a bit with funeral parlors in the country in terms of their fleet. I'm very passionate, as Eugene will know, about encouraging the motor industry in South Africa to get more proactively involved with the funeral industry. And I spend quite a bit of time facilitating events that can help in this regard. Thank you for the opportunity to share a few thoughts on how the funeral industry has been affected and adapted and changed in response to COVID, our journey with COVID. When Master Drive asked me if I could share a few of my thoughts, I said I'm thankful for the opportunity. However, as a service provider to the industry, I thought it may be of more value to you guys if I bring somebody with me who is working directly in the industry. So today, to introduce Mr. Pat Swani, dear friend of mine, and Pat is also the National Fleet and Assets Manager for B3 and B3 Funeral Services in South Africa. Pat?
Thank you, Rachel. Hi, guys.
Okay, so Pat, a few questions the guys are wanting to know about how the funeral industry has adapted and changed. What would you say, Pat, has been the effect of COVID-19 on the funeral industry?
When COVID-19 came into the light, came into South Africa, we were all not prepared. Not everyone has thought that we should have a budget for PPEs. We should have a budget for all those extra things that are needed. There was no provision at all regarding like some of these pandemics that are coming on. So the effect that we've seen is that there was a huge increase in the demand for services. And also when it comes to demand for services, you also experience a huge strain on people processing claims, a huge strain on people doing consultation. The most effect was also on the people who have to go and collect the mortal remains of their loved ones that have passed on. So it has had a huge effect. And also when it comes to the issue of COVID-19, until recently, we had an issue whereby, remember the stigma where people will try and look badly on people who are affected by COVID. And also you have an issue whereby legislation before that has dictated that full PPEs must be worn when handling that. Families couldn't see their loved ones or say their goodbyes to their loved ones because now of these body bags that were required, and the uncertainty in terms of, is it the right body, is it the right person, is it the right people? We've seen in other areas whereby people are now starting to redig the graves just to make sure that it's the right person. So when it comes to the issue of PPEs, when you're conducting the funeral service, your people will see that already by mere fact of wearing the PPEs, already you're telling people that the disease has passed on with COVID. And it's really sad, and because in some of the cases, what you do is when you collect maybe one partner or an individual, 2 or 3 days later, you go back and collect another one after you've done a funeral to say, okay, there's another one who's passed on, there's another one who's passed on, which is, it's very sad within the same family, and within like a space of a week or 2 weeks, seeing many families experiencing that. And that's some of the challenges that you are faced with when it comes to COVID-19. But the biggest one in terms of providing the service, it's now there's an increase in demand. All of a sudden, there was a spike in the demand for service, for funeral service. When you look at now in terms of the COVID, normally I describe it as the first wave and the second wave. The first wave hit hard on Gauteng. So in terms of the demand for services, it was moderately controlled because the authorities now, what they did was to introduce now to allocate times. Previously, especially with the African community, everybody wanted a Saturday, 9 o'clock. So when you go to all the cemeteries on Saturday at 9 o'clock, it's all jam-packed. It's everyone trying to squeeze into the cemetery. But now with the allocations of time by the authorities now, that thing went away now because it was controlled access and controlled times as well, because they were able to say at 9 we're expecting this family, at 10 we're expecting this family, and also the shorter the service. That some of the issues that we've experienced in terms of when COVID-19 hits. The first wave was much mild than the second wave. The second wave was quite huge. It was because what it did was it was not only big in Gauteng, it was big nationally. So that's where the difference is, and it quite went through the whole period of January. Thank you.
Thanks, Pat. Next question. What are some of the changes that funeral homes like B3 have had to put in place to deal with COVID?
Like any other business, we had to do partitioning, follow the COVID-19 regulations, and also the one that affected the family most, it's like when we have to select the number of people you have to consult, because now in most cases we find that there's in like pre-COVID times, there will be 3 or 4 people in the consultation room. But now they've changed now whereby we have to limit in order to control the spread of the disease. And also the fumigation of premises continuously, the making availability of all the sanitizers, ensuring that the staff follow the COVID rules regulation. Because remember, we were dealing with COVID-19 victims at our doorstep. So it was very critical that proper precautions are taken, the way we handle the disease, and also separating the COVID-19 patient, casualties from the normal death, natural death casualties. So those are some of the challenges. And also when it comes to vehicles, ensuring that vehicles are fumigated all the time in order to prevent further spreading of the disease. Thank you.
Thanks, Pat. Pat, regarding the changes, do you believe that for parlours in South Africa, some of these changes that have been implemented could become a permanent feature, even after COVID is no longer perceived to be a challenge?
I think when you look at changes, not all changes are bad. Some of the changes that have been there, although they might be affecting our client, it's for example, the issue that they can't choose the time that they want, and also the time that the government was limiting for the human remains to be at our premises. It also gave a change in picture, because if the government is allocating the time, then you know that there's no stampede at the cemeteries, you know that there's control. You are able also to allocate proper timing in terms of the funerals, because if there's no control in timing, in some cases you find that a service that's supposed to be at the cemetery at 10 o'clock only leaves the home or the hall or the service center, the church, at 10 o'clock because there were too many speakers. And then that will affect now the traffic jam at the cemetery. So now all the service providers, funeral service providers, they are aware that if they've allocated 10 o'clock, you need to allocate an earlier time to the family so that you can give yourself enough time so that come 10 o'clock, you are at the cemetery, at the gate, verification, the number of people that are attending, because the authorities were very strict with this one. That must give them a heads up, because they really did control it very well. Not all the cemeteries were able to do that, but majority of the cemeteries, they were able to do that. So those changes were positive. And also in terms of like, when it comes to grave closure, people really were not comfortable in terms of like, because we used to have like normal, all traditional grave closers with shovels and spade being used. But now with the new COVID regulation, majority of the time there was a provision of the TLB. So that has also made the turnaround time for the service at the cemetery to be shorter, and basically your service is getting shorter and faster. So that's some of the changes that people have got accustomed to, and the reduction in the number of people allocated to come to the cemeteries. Those are some of the changes that I think will be with us forever. It will be difficult for us to just discard them, as they are beneficial to both the clients, the families, and also to the industry. Thanks.
Pat, what would you say are some lessons that the pandemic has taught both B3 funerals and the funeral industry at large in South Africa? What lessons has the industry learned, and yourselves in particular?
Okay, one of the biggest lessons is proper planning. And the other thing is also be able to make provision for uncertainty. It should be the bigger part of your budget, your planning, and be able to stand up, because we might have COVID-19 now. We're not sure where Ebola is going to go in terms of if it's not properly controlled. When you look at the access to our borders in and out, it's not properly controlled. And then we might end up with maybe a case of Ebola, which if not properly controlled or detected, it might spread. If you look at places like Alexandra, where there's dense population concentrated there, so it's easy for such diseases. So we should keep in mind that should there be any eventuality that we get some of those diseases, because remember with COVID-19, everybody was saying, or in 2019, they were saying it's a Chinese disease, like what your former US president called it, and people never took note of that to say, maybe one day it's not going to be a Chinese disease, it's going to be a South African variant. So which is what we're seeing today. Thank you.
Thank you, Pat. Pat, would you say the limitations on funerals, particularly in attendance, coming down to 50, has it caused the industry to evolve? Do you think the industry is fine with that and it's changes up going forward, or do you think it's going to go back?
It's caused the industry, like any other industry, we've evolved. We're moving into digital technology, more use of digital technology, because one of the examples is that the funeral service normally will be offered live on web, and then also the service providers are strictly dealing on that, ensuring that everyone who wants to attend, they're able to log on and just be there in spirit, even though they're not there physical, but in spirit, follow the whole procession from the service right up until the cemetery. So that's one of the very, very good changes that has come about. And also, I don't think we'll be able to discard that. I think we'll now move more into digital space as an industry.
Thanks, Pat. Pat, if you guys look back on 2020 as B3 Funerals, what would you say was the biggest lesson learned in your business?
The biggest lesson learned is being vigilant in terms of the customer service, being vigilant in terms of, like, now when it comes to your driver fatigue, if not properly controlled, it will have a devastating effect on the pocket, devastating effect on the driver's health. So it's very important that your driver's fatigue, the allocation of times, giving them time to rest, because when there's a higher demand, because in terms of the staff that you have, you've budgeted to have now a certain number of staff, as happened in the previous years and all those things, but now things have changed. And then now you find that as there is more demand for service, then you're restricted to this number. You have to change and also make sure that you adapt to the new, so that because what you save in human labor or human capital, you might end up losing it on other things like your accidents, your driver's health attendance, and all those things, and also your standard of service, because if you don't attend to those, you might see like the lowering of standard of service because the drivers are very, very tired So it's very important that the human element is really controlled and managed properly. And also your clients, it's very important that your clients are on top of your priority list. You can't let your clients down because now there's too many services. That's very important for the industry.
Thank you, Pat. Pat, is there anything else you would like to add in terms of how the funeral industry in our country has been affected, changed, or you?
Okay. What has happened is that we don't need to, because you might find that the perception is that the industry is the one who are smiling all the way to the bank. But the cost of conducting the services has just increased, eroding all that profit. So you might see in the later stage, some of the service providers might not be able to survive due to the high cost of conducting the funeral service. You look at now during lockdown where your roads are not properly maintained, potholes and all those things damaging the cars. So that's a cost to the business, and that needs to be recovered from someone. And unfortunately, it can only be recovered from the cost of the funeral from the client, which is not a good thing. So it's very important that those things are properly managed. And also, when it comes to the actual relationship between the industry and the authorities, it's important that we need to increase the relationship between the industry and the authorities in order for them to understand the needs of the funeral industry. Why do we need properly tarred road? Why do we need escort during funerals in order not to disturb your normal citizens, but to try and use the road in a very healthy and proper way, so that no one gets to fight with the road rage and all those things within the funeral industry. That's very important. And yeah, during lockdown also, when you look at one of the lessons that we needed to learn was that time management, proper management, always keep your fleet, try and maintain a very hygienic way in your fleet. Fumigation, ensuring that the sanitizers for drivers and family members. Those are some of the things that we don't need to let them go. We need to keep them for the survival of everyone.
Thank you so much, Pat.
Thank you.
As many know, Fridays in the industry is typically a very busy day. So thank you, Pat, so much for giving up your time to be here and join us today. Thank you, Eugene, and thank you, Master Drive.
Hey, Rachel, Pat, thank you very much. I'm sure this was a rather refreshing insight into, I'm sure you've heard the phrase, it's an industry people are dying to get into, but it gave us some perspective of where we are, what's happening, and notwithstanding the fact that we may think it's lucrative, they are suffering as well, as is everyone else. So thank you very much for that, and we please do trust that if anybody's got any questions, you may be around, but we'll happily forward them to you if they like to do so. So now we move to the last part of our session, which is literally just a thank you. We're going to be giving away several prizes again, as is our custom. So when you attend the Master Drive event, this is what we share with you. But I would like to just have a look at questions that we have been posed to us over the months and years as to whether or not this will be something that's permanent. How do we feel about sharing cars with individuals? From a Master Drive perspective, everything is done to sanitize the vehicle, sanitize the space in which they work. And of course, we've also gone to the extent of being able to offer e-learning, virtual learning. And the good news is that many corporates are taking road safety as seriously as what they do COVID. Any questions from the audience? We'll just, if you'd like to put your camera on or use one of the reactions on there, and then you can speak with us and we'll share the answers to the extent that we can. Let's just see there's something in the chat. All right. No? Okay. Let's move on in the interest of time. And let's just share with you, it's a video. As you will have recalled, Leighton discussed one of the major challenges that we have, and that has to do with distracted while driving. So some of the prizes that we'll be giving away now has to do with some e-learning courses, which makes use of virtual technology to train you. If they aren't suitable for you, please, if you're the winner, feel free to share it with somebody else that's deserving. We'd be more than happy to do that. And then there's a one-year subscription to Ping. The video that we'll share with you in a moment will explain it. But given the fact that distracted while driving is attributed to causing about 25% of crashes on the road, it's about time that we do something about it. Master Drive introduced last year and in this year as well, products that will help facilitate the control of cell phones and prevent them being the danger that they are. So let's play the video and then we'll hand out the prizes after that. There's no sound. Just bear with us, please, folks, as we sort that out.
You have a new text message from husband. Are you almost home? I need reinforcements.
Hey, close with the birthday girl?
You have a new Facebook message from Carly Realtor. Congrats on selling the house on Willow Avenue.
You are in drive mode. You have a new WhatsApp message from Peter Boss. Team meeting confirmed for 5:30 p.m. today. You have a new email from dispatch. Updated delivery address is 224 Main Street. You are in drive mode.
Folks, what you saw there was a very brief introductory to the product called Ping. We do know that the greater majority of challenges relate not necessarily to the speaking on a cell phone, although that is a distraction in itself, but people's inability not to read messages that come across their phone, and that's why it's called Ping. This converts mails or messages, whether it's in WhatsApp or message form, into a voiceover that will ensure that everybody can get the message and not be distracted by the instrument on their desk, excuse me, on their dash or on the seat next to them. So we are now going to give away some prizes. Please, if you'd like more information on that and on our no-cell product, drop us a note and you will appreciate just what value it brings to our lives on an everyday basis. Let's give away some prizes now. E-learning, we indicated we give away 4 e-learning programs, and please, if it's not for you, we're happy that you can transfer it to somebody else. We have Ponzo Mortlani from Westbank, you one winner, Ivan Moodley, DCB, Natasha Barnett from Crossroads, Abdullah Muret from Unitrans Cape Town. So thank you very much for agreeing to accept those. We know it will improve your driving and we trust that you will be better off for it. The Ping application, this is a 1-year subscription. The cost would normally be in the region of, I think, about 300-400 Rand a month. This has been going to 4 lucky people. And the first one would be Julia Benz, the second one, Gisela Kemp, Tashaki Naidu, and then Zanele Mkutwana from Vodacom. So please, folks, contact the team, Nishani, Sam, or any of the others, and we will ensure that you get access to the prizes. Once again, thank you very much for joining us. We appreciate the privilege of being able to share this time with you in a very difficult and time-sensitive aspect in our lives. So thank you again. Drive safe, and please, if you need anything, please feel free to call on us. We're more than happy to advise and help where needed. Take care.